Hey guys, I'm David.
And I'm Steve.
And we're going to talk about hair transplant and the healing process today. And also in relation to exosomes a little bit, since that's kind of a hot topic lately on our channel, since it's something that the doctor that Steve primarily works with, though he works with a bunch of different people, Dr. McGrath has started using exosomes, so it's something that a lot of you guys have had questions about. So we thought we'd talk about exosomes and the healing process and just healing process in general for hair transplants. So, all right, take it away, Steve.
Okay, great. Yeah, the healing process for a hair transplant is going to depend upon whether it's FUT or FUE. The FUT procedure, believe it or not, kind of looks pretty normal walking out the door of the clinic. You're not going to see anything in the back of the head at all because the hair is going to be grown long, combed up, kind of taped away, and then the suture line is not going to be exposed. So with either a medical cap or a hat, you're walking out the door kind of like you walked in the morning.
I don't know if this is something I should admit on video, but hey, why not? I actually had a threesome with the stitches still in my head.
Maybe you shouldn't admit that on video.
It's okay.
Okay.
But yeah, so, and the girls had no idea that I had like stitches in the back of my head. Yeah. So yeah, it is pretty unnoticeable, I would say.
Yeah, so the FUT...
Not that they were examining my head. Not that one.
Absolutely.
Anyway, all right, so go ahead. Yes.
The FUT... Okay, let me start over. So the FUT will, the first couple of days is what really is where all the healing is. You really have to take it easy. You have to keep your heart rate down. You have to keep your head raised when you're sleeping. But after about 3 days, you're almost already using full water pressure in the shower, and your scabbing, as long as you're healthy, is kind of going away already. So I would say in the area of about 5 to 7 days, you're pretty good. Some patients get some swelling. We can talk about that. But that's rare. You just have to follow the instructions. Now the FUE procedure, as much as a lot of the viewers may want to feel that that's the easier procedure, we actually have to shave the entire donor zone all the way at the back and around over the ears in order to do it properly. In order to do FUE properly, the idea is very little scarring, at least from an optical illusion when you look at the back of someone's head with a very low haircut. In order to do that, you have to take over a vast area. Yep. If we took all the hair from the very inside interior, then it would be blank. So it makes no sense. So we have to shave it. So that's a problem for a lot of people out there that don't want to leave their head shaved. It might take 3 weeks, 4 weeks. It depends on how long your hair takes to grow in. But healing-wise, though, as long as it's done right, those little scabs in the back will heal up pretty quickly. That'll take maybe 5 to 7 days. You can go back to the gym in about 5 to 7 days, and then the front, or the top, where the recipient area where we put the grafts, that's going to scab up, and as long as you take care of it properly, same thing, about 5 to 7 days.
About the same as FUT.
About the same as FUT. A lot of people have the misinformation that they can go right back to the gym, like they can go bench pressing like 2 days after an FUE procedure. Yeah. Absolutely not. I mean, we have to worry about both, the recipient area and the donor site. So it's still going to be about the same. The only real difference is that when healing with an FUT procedure in the back, you're going to feel a little tighter back.
Yep. Tighter and probably more itchiness, I'm guessing.
There's still itchiness with the FUE,
okay, gotcha.
but a lot of guys, it depends on your skin type. It depends on, your pain tolerance. If it's done right by a great, board certified specialist, you're not going to have a lot of pain. It should be more of a superficial wound type incision rather than deep tissue. Yep. So, healing wise, to just put it in summary, either procedure, it depends on how long your hair takes to grow back with FUE, but you're probably looking at about a 10-day time frame.
And with the exosomes, you guys were, I know Dr. McGrath, when I was talking to him the other day, was saying that he's seen faster regrowth with the hair transplants with the combination of exosomes. What is that usually like, and what have you been seeing over the last year and a half of doing this?
I have a great example for you. I'll make it very precise. I sat in a room with Dr. McGrath, from all day long when I was spending time at his clinic. Immediately after he had an FUE procedure done with 2,200 grafts in the very front hairline. He, at the same time, I believe he had 7 cc's of pure exosomes, not diluted. Big difference. That was injected in the tissue plane throughout the scalp from front to back. And keep this in mind. I met Dr. McGrath in 2002. He left his medical practice of general surgery in 2002 and started to learn how to do this. And he allowed the doctor who was training him to do a hair transplant on him. I swear to God, he did not have one hair grow in for 9 months. He's what we call a slow grower. That's not easy. It's not easy for the clinic. It's not easy for the patient. Wow. Could be protoplasm, could be other issues, but he was always a healthy guy. He was like 36 years old at the time. think about this. 18 years later, he goes and gets a hair transplant. He's 55 years old. Now he's still in good shape, but he's 55 years old.
Yeah.
He has this exosomes injected, and I was looking at his post-op, and after like 30 days, I started seeing these changes, and I'm like, what the heck is going on? After about 3 months, his entire head changed. All the hairs on his head just exploded. And at 5 months, almost all the hair in his FUE procedure has grown in.
Yeah.
And I am shocked. I mean, when I say shocked, we have never had this conversation, but I am a critic of this industry. I don't trust anybody. I don't trust anything. I don't believe anything. So when you tell me you're going to shoot my head up with exosomes and all my hair is going to grow back on a bald head in 1 month, I'm a skeptic.
Yeah.
But what I saw with him, sitting on a chair watching him on a daily basis, was pretty impressive. Now, that doesn't mean, that that's going to happen to everybody.
Yeah.
That doesn't mean everybody's going to respond the same way. So, as you know, the old saying, results may vary. But regarding what you said in hair transplants and exosomes as a conjunctive therapy, that I'm already a believer in.
Awesome. Hope this helps answer you guys' questions. Thank you for all the questions in the comments. It really inspires us to make videos and to try and find you answers.
Thank you.